It is also known as AI rod. What are the functions of this catheter? These can be used for the insemination by the use of fresh semen, and it can be used for the infusion of the antibiotic inside the uterus, and again it can be used for the collection of the sample from the uterus. Plus, sometimes we can go for the douching or the lavage of the uterus by the use of this catheter. Okay. So, what is the method to pass this catheter inside the uterus? You have to hold the rod by your hand. Just you can touch the rod over up to that much length. That is minimum. You can say up to 5 or 6 centimeters. You are not allowed to touch anywhere from the, you can say, other than this surface. Why? Because if you are going to touch from here, you are contaminating the rod. So this portion is just will be outside the uterus, will be outside the reproductive tract. That's why we can hold from here. So you just have to suppose that I'm just standing behind the cow, and this is the vulva of the cow. Suppose that I'm just standing behind the cow. This is the vulva of the cow, and this is the vagina, and then there is the external os of the cervix. Okay. So initially we have to pass the rod by making 45 angle. The angle of 45 degree with the vulva of the cow, the buffalo, which one is the animal. Why? Because you know that up to 5 or 7 centimeters there is vestibule. There is vestibule. What is vestibule? The caudal-most part of the vagina that is having the pelvic urethra and urethral diverticulum and clitoris. So we just have to avoid this passage. In this way, when you are going to make the 45 degree with the vulva, and you have to pass up to 5 to 6 centimeters making this angle. The tip of the rod will touch the floor of the vagina, the roof of the vagina, not the floor. Why? Because we are just going to avoid the pelvic urethra. If we are not following this type of the angle, we are just going to pass the rod in a straight pattern. This can get entered inside the pelvic urethra, and it will be contaminated with the urine, or it can just stuck in the urethral diverticulum. So to avoid this kind of the problem, we have to pass initially the rod up to 5 to 7 centimeters by making the 45 angle with the vulva. Then you can easily insert your hand inside the rectum, and you are looking for the landmark, that is cervix. You have to hold it between your index finger and middle finger in such a way the tip of your thumb should be free to check the status of the external os, either it is open or closed, or if it is of the normal shape or the abnormal shape. Plus, this tip of your thumb will guide, it will help you to fornix, that is the blind pouch around the external os. So once you have holded the cervix, you will retract the track and you will make the cervix more closer to you. Then you can easily make this rod straighten. Okay. We are just going to resolve the 45 angle to the right angle. Okay. And then you can easily pass the rod. When the tip of the rod is just touching your tip of the thumb, it means that the rod is at the right place. Once you have inserted the rod inside the external os, then you can easily fix the rod and the cervix with the help of your hand, and then you can just manipulate the cervix in such a way. You know that the lumen of the cervix is not smooth inside. It is having the cervical rings. There are some, you can say, ridges, some are the grooves. Okay, so you have to manipulate in such a way that, like that, you just moving from the first ring, then from the second ring, and you can move up to the body of the uterus. Okay, so up to the body of the uterus, you can feel the tip of the rod. So you just have to manipulate the cervix. The movement of the rod should not be very freely. You can move the rod up and down up to that much angle. You can move up to the right and left side up to that much angle. If you just have fixed the rod over here, and now you are going to move extremely up to the extreme right or left, it can be get broken inside the vagina. And then once it is broken, there will be rough edges of the broken end, and that can, you can say, damage the vaginal mucosa. Okay, you can do the practice with all other tracks. You have to pass the catheter only up to the body of uterus. Only up to the body of uterus. Why? Because whenever you are going to do the artificial insemination, the semen should be deposited in the body of uterus, because you have not the idea from which of the ovaries is going to ovulate. So these are the sperms that are very sharp, that are very genius. They can have the idea by sense of some kind of the chemotactic chemicals from the oocyte, from which of the ovaries is going to be released. All these sperms will move toward that horn. Okay, you can go for the deep intrauterine insemination if you look for this animal. Okay, sometimes you can feel some kind of a difficulty to pass the rod, particularly when the animal is having, you can say, the particular area of the cervix. There is some kind of the fibrosis inside. It means that there will be some kind of the difficulty to pass the rod up to the body of uterus. in such animal. You have to manipulate, or then you can easily go. You can feed. I just have manipulated. I just ignored the area that is having some kind of the pressure, or you can say internal fibrosis. There was a way from where we can pass it. Then you can easily. This is the body of uterus. You can pass the rod up to that much. You can say length of the uterus to the body of uterus, and then can infuse the semen. But if you have the idea, the animal has ovulated from the right side or the left side, or it is actually going to ovulate from the right or left side, it means that you have observed the follicle dominant or the ovulatory follicle before insemination. Okay, then you can go for the deep intrauterine insemination. It means that this is just going toward the left horn. Okay, toward the left horn. That will be known as deep intrauterine insemination toward the left horn. And then similarly, if you want to do for the to infuse the semen toward the right horn, this is again the deep intrauterine insemination. So generally, this is not the deep intrauterine insemination every time. This is only in a case when you have the idea this ovary is having the follicle on the ovary that is ovulatory and dominant. Plus, you have the history. This cow has some kind of the repeat breeding history with all other normal parameters. There is no problem with the time of the ovulation, no problem with the uterine wall. Okay, then you are just going to make sure maximum concentration of the sperms to make sure to get more closer toward the site of fertilization. So these are some special cases. Otherwise, generally you just have to pass the EI rod up to the body of uterus. Okay, then you can infuse over here.